My name is Melanie Maura, and I'm going to talk about chlamydia complications. Definition: Chlamydia is a common sexually transmitted disease caused by the bacterium Chlamydia trachomatis, which can damage a woman's reproductive organs. Even though symptoms of chlamydia are usually mild or absent, serious complications that cause irreversible damage, including infertility, can occur silently before a woman even recognizes a problem. Chlamydia also can cause discharge from the penis of an infected man.
What is it, and how does it spread?
Well, chlamydia is, as we explained earlier, is also a sexually transmitted disease. Is caused by Chlamydia trachomatis, and it's so common and so persistent because it's a silent disease. You could have it forever and don't know you have it. And the most likely is sometimes you get a clear discharge, vaginal discharge, but that so many it's so common for women to have discharges that they don't even notice that they have this. So nowadays the recommendation is that anyone gets before the age 24 gets a screen for a chlamydia infection. And it's very simple to be screened for a chlamydia infection. You could do it in urine, you could do it through a cervical swab. Why is this so important? Because the chlamydia is something that you pass from one partner to the next, especially in people who have multiple sexual partners. And chlamydia, even though it does not cause any particular severe infection, it causes a lot of issues with infertility later on in life. It affects the fallopian tubes and could predispose to ectopic pregnancy and other complications that are associated with it.
Yeah, I wanted to get to that too because you mentioned infertility, but there's a number of complications here with chlamydia I don't think people would immediately think about.
Right, exactly, especially because it's such a silent disease. It's going to cause pelvic inflammatory diseases and inflammation of the pelvic cavity. Infertility because it affects the fallopian tubes. The fallopian tube have a cilia, which is what allows the motility of that sperm to travel and the egg to travel and meet the sperm. And when that cilia gets affected somehow, it predisposes to ectopic pregnancy. What happens with ectopic pregnancy? Well, ectopic pregnancies are those pregnancies that occur outside the uterus that could rupture, and it's an increased risk of maternal mortality. As well as pregnancy complications, chlamydia infection could predispose to preterm labors, and newborn complications. Well, babies are born, they use antibiotic on the eyes, and the reason is to prevent chlamydia infection.
Applications in medicine. How is chlamydia transmitted? Chlamydia can be transmitted through sexual contact and sharing of sex toys. Transmission occurs when secretions from infected mucous membranes or semen of a person with the urethral infection comes into contact with the mucous membranes of another person. The symptoms are: many people with chlamydia have no symptoms. If symptoms do occur, they usually appear 2 to 3 weeks after infection, the incubation period, but it can take as long as 6 weeks. Infection of the cervix. Symptoms may include an unusual discharge, a fluid that flows out of the opening of the vagina, unusual vaginal odor, pain during vaginal intercourse, and bleeding between menstrual periods. Infection of the urethra. Symptoms may include a yellow or white watery or milky discharge, a painful burning sensation during urination, urethral itching, and testicular pain and swelling. Untreated chlamydia infection of the cervix can spread to the uterus and fallopian tubes and can cause pelvic inflammatory disease. In the urethra, inflammation of the epididymitis called epididymitis. The epididymitis is a tube in the testicle that stores and carries sperm. Rectum can lead to proctitis, an inflammation of the lining of the rectum which can become chronic. An infection caused by chlamydia can cause scarring of the cornea.
Hello, I am Dr. Rachel Gorwitz, Medical Officer in the Division of STD Prevention at the Centers for Disease Control and Prevention. Although most chlamydia cases reported are among teens and young adults, any sexually active person can get this sexually transmitted disease, or STD. In fact, CDC estimates there are nearly 3 million new cases of chlamydia each year. People get chlamydia by having vaginal, anal, or oral sex with someone who has this STD. Most people with chlamydia have no symptoms, which is why the infection often goes undiagnosed. If symptoms occur, they may not appear until weeks after having sex with someone who is infected. Women with chlamydia may have an abnormal vaginal discharge or burning sensation when urinating. Men with chlamydia may have a discharge from the penis or a burning sensation when urinating. Even when a chlamydial infection does not cause symptoms, if left untreated, it can go on to cause pelvic inflammatory disease, chronic pelvic pain, or make it difficult or impossible for a woman to get pregnant. CDC recommends that sexually active women under age 26 be tested for chlamydia every year.
Application in Ecuador. According to the WHO, more than 1 million people acquire an STI every day. The two main causes of these STIs are Clamydia trachomatis, followed by Neisseria gonorrhoeae. Given that approximately 80% of cases are asymptomatic, the prevalence of such infections cannot be accurately determined. Sexually transmitted diseases have become a public health problem, especially in developing countries. This has happened because the beginning of sexual activity is earlier and earlier. In our country, 59.3% of women and 70.5% of men aged 15 to 24 have already had some sexual experience. In Ecuador, the prevalence of sexually transmitted infections in a young population is not established, since there is no established screening and continuous monitoring program. Pros and cons. Fortunately, chlamydia is a bacterial STI and can be cured with a simple round of antibiotics. Most of the time. However, it is asymptomatic is 70 to 95% of women and 90% of men. This is why it is so important to practice safe sex and get tests every 3 to 6 months or with every new partner. Testing is a simple and quick and can now be done with a swab you can do yourself. People often pass the infection on and not know because it is called the silent epidemic. It can be passed from vaginal, anal, and oral sex. If left untreated, chlamydia can cause pelvic inflammatory disease in people with vaginas and epididymitis in people with penises, which can lead to infertility in both. No STI is the end of the world. They happen sometimes. Just be sure to get treated. Inform all your partners. Wait until you finish treatment to have sex and get tested again in 3 months. In conclusion, the surest way to avoid transmission of STDs is to abstain from sexual contact or to be in a long-term mutually monogamous relationship with a partner who has been tested and is known to be uninfected. Latex male condoms, when used consistently and correctly, can reduce the risk of transmission of chlamydia. CDC recommends yearly chlamydia testing of all sexually active women aged 25 or younger, older women with risk factors for chlamydia infections, and all pregnant women. An appropriate sexual risk assessment by a health care provider should always be conducted and may indicate more frequent screening for